It's really itching and burning.
Are you sexually active and are you experiencing itching and burning? So when I had chlamydia, I didn't experience any of the typical symptoms. I heard that there was like itching and burning and stuff like that. Well, I didn't experience any of that. I didn't know I had chlamydia until I went to my doctor, and he looked up in my coochie, and boom, he prescribed me erythromycin and stuff like that. I guess it helped. I don't know. But I've had a boyfriend for about 2 years now, and for 2 weeks since I was on that stuff, I couldn't have sex with him. So that was difficult. But yeah, that's my story.
Whenever I had trichomonas, I really did not know for the longest time, but I had terrible itching and burning when I peed, and then oh my goodness, the smell. It was like fish. Everybody kept telling me to close my legs. It wasn't until my doctor prescribed me metronidazole that I felt better almost immediately. I forgot what it felt like to feel normal. I had to refrain from sex for about a week, unfortunately, but I'm back to normal now and back to being sexually active with protection.
So I got the clap, also known as gonorrhea. I had painful urination, intense itchiness, and this weird discharge. And the cramping in my lower stomach was so bad. It wasn't until my doctor prescribed me ceftriaxone shot and azithromycin, the antibiotic, that I started feeling better. They told me not to have sex for 7 days, but I only waited 6.
I have BV. It's similar to a yeast infection I got last year, but instead of prescribing me azithromycin like they did last time, I'm taking metronidazole. It's the similar symptoms though, discharge, a little bit of smelling, some itching, but it's not like an STI or anything. My doctor said it probably came from me working out and not showering right away after.
Being pregnant with twins is already a hard thing to do, but then I found out I have gonorrhea. My OBGYN suggested that I get tested, and I found out that I had it. Good thing I got treated for it though, because my newborn babies could have had blindness from this. There's also other STIs like chlamydia and trichomonas that can cause low birth weights or premature babies. And so it's very important, I learned, that I go get tested early for these things.
Hi Haley, I'm Brooke and I'm going to be your nurse today.
Okay.
So I just have some couple questions I want to ask you if that's okay.
Yeah, for sure.
Okay. So are you sexually active?
Yes, I am.
Okay. Can you kind of tell me the last time you engaged in any kind of sexual activity?
What time is it actually? Me and my boyfriend had sex like 3 hours ago.
3 hours ago?
Is that okay?
Oh no, yeah.
Okay.
Just want honest answers.
Okay.
So you said boyfriend. So are you just sexually active with men? Are you sexually active with
Oh,
women?
no. I do both.
You do both?
Yes.
Okay.
So me and my boyfriend actually just started dating like a month ago.
Okay.
But I was with women before that for like a couple months. I got with about 3 of them. And then before that, I'd have to think about it. But anyway, sorry. Go ahead.
No, you're good. Okay. Can you kind of tell me how many sexual partners you've had in the last couple, like last year, I would say?
Probably around 10.
10?
I would say,
Okay.
yeah.
Okay. Do you use any kind of protection?
No, I don't like the way it feels.
No.
Yeah,
Okay.
no.
Have you ever gotten tested for any like STDs, STIs?
I did once. I had chlamydia.
Okay.
And I thought it was gonna be like the end of the world because that one scene in Mean Girls.
Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it. Promise? Okay, everybody take some rubbers. At your age, you're gonna be having a lot of urges. You're gonna wanna take off your clothes and touch each other. But if you do touch each other, you will get chlamydia and die.
So I thought it was like the end. But they gave me some medicine and it went away. I couldn't have sex for like a week, but it wasn't even a big deal. I had like no signs or symptoms of it.
Okay.
Yeah.
Okay. So with that, with you not using any protection, do you have like any plans for like unplanned pregnancy, or have ever thought of getting pregnant?
No. Me and my boyfriend used the pull-out method. Yeah.
Okay. Just the pull-out method, no condoms, no nothing?
No.
No.
I don't like the way condoms feel.
Oh, yes.
So we just do the pull-out method, and so far it's been working for us.
Okay. Do you have any problems with sexual function, like getting aroused?
No.
No. Problems with lubricating or lubrication?
No.
Any pain during sexual activity?
You know what? There was this one time I actually experienced like really bad pain.
Okay.
Yeah. But it was just one time. I think it might have been like the angle or something
Okay.
we were in. I don't know. But besides that, no.
No? Okay. Any problems with orgasm?
Oh, absolutely not.
No? Okay. Is there anything else that I need to know about your sexuality that could kind of help me better my medical care for you, my plan?
I don't think so.
Think so?
No. Well, actually, me and my boyfriend have been thinking about, I know it sounds crazy, but like maybe having other people get involved.
Okay.
Yeah. So maybe that, but besides that, no, that's it.
Alrighty.
So as you could see from that interview, there's a lot of good things. The nurse made the patient feel really comfortable so she could share all the details about her sexual history, which is really important whenever creating a care plan or testing for STIs to know everything that's going on with the patient. But there is some education that we need to do with the patient. So most signs and symptoms of STIs include itching, burning, discharge, especially burning with urination. So we'd like to educate the patient to look out for those signs and symptoms, especially with having as many sexual partners as she does. So ways to prevent STIs, since she does not want to stop having sex, we're going to recommend condoms for this patient so that it's a barrier of protection against STIs. So she said that she uses the pull-out method for her contraception, and that's not a very reliable method, so we'd like to recommend birth control. And if she can't afford birth control, the health department often supplies birth control, as well as Planned Parenthood does as well. So we want to educate on the risk of having multiple partners, and she said she had 10 in the past year. So she's more susceptible to STIs, infections, and such as BV and yeast infections. If she were to become pregnant with any of these STIs, it could affect her pregnancy and her baby, causing abnormalities, diseases, or even like passing on the infection to the baby.
Some important facts to know about STIs is that many people won't experience any signs or symptoms. This is why it's important to get tested regularly. Although you don't have any signs or symptoms, you can still spread the infection. Did you know 1 in 2 sexually active individuals will contract an STI by the age of 25? Also, STIs are very common. There's more than 19 million per year. Other things to know about other reproductive infections such as BV and yeast infection is that although they're not considered STIs, they can increase your risk of contracting one. These can also be diagnosed through tests, and there's medications to treat them as well. Although not all STIs are curable, they all are treatable.
Itching and burning when I pee.
When I had chlamydia, I didn't experience any symptoms. I'm so bad at this.
I have BV.
So I got the clap, also known as gonorrhea.
I love the
I had trichomonas. I didn't know for the longest time, but I had this terrible itching and burning while I peed. And the smell, oh my gosh, it was like fish. Everybody. Sorry.